start with breaking news tonight of a new ATP pump design known as the Kinetic Maker. The pump is about the size of a smartphone or deck of cards and is worn on the outside of your body to deliver ATP through a tube into a layer of fat under your skin, typically around your stomach area, as an insulin pump would be worn. The pump can be worn around your waist or attached to a belt or bra, in your pocket, or on an armband. There are a variety of custom-made accessories so you can carry your ATP pump with you at all times. This ATP pump will deliver ATP to the muscles for someone with a spinal cord injury. The pump is touchscreen on the outside and has programmed activities. Similar to an insulin pump, there's a small computerized device that delivers variable doses of ATP to your skeletal muscles. A healthcare team will teach you how to fill the pump reservoir, prime your tubing, and select an infusion site to best help you with your skeletal muscles in your lower legs. The electrodes and wires from the Kinetic Maker ATP pump will connect to the skeletal muscles in your lower limbs. The metal is used as a bulk material to conduct the electrical signals down to the muscles. There's 2 layers of silicone on each of the electrodes. The inner layer upholds the function and stability for a long period of time and is made of fluoropolymeric structure. The outer layer is silicone with the addition of nitrocellulose so that it is stable and will not hydrolyze. It also has minimal biological reactivity, low body toxicity, and is non-carcinogenic. Biofilms will form around the surface to incorporate the material into the muscles. And a bioactive coating will be used to control cellular and tissue responses. Biocompatibility, known as the ability of the material to perform with the appropriate host response in a specific situation, is held by this material. Teflon, a brand of man-made chemical, has been used since the 1940s and has a wide variety of uses due to its stability. It can also provide almost a frictionless surface for the ATP pump. Medical grade silicones, as the 2 layers of the silicones in the electrodes, satisfy the biocompatibility and anti-toxicity of the ATP pump and are non-irritating and non-sensitizing behaviors in the body. Now to Kara Ransbury with an overview of the ATP pump.
Hi, I'm Kara Ransbury and I'm here to tell you about how the ATP pump actually works, or the external part of it. So here we have the on button, which obviously you turn it on. And here we have the ATP reservoir. So that's where you're going to collect your ATP, and that's going to get transformed through the equipment and then go through the tube here, which goes to the cannula and through the wires to the electrodes. Here you can charge your ATP pump at night as you do your cell phone, so you can just plug it into the wall and it's rechargeable every night. And it has the touch screen and has many different options of what actions you can perform. So there's 3 different slides, and this is just an example of 6 different activities that you can do. So here's an overall diagram of what the Kinetic Maker actually looks like on a person. You can connect it to your belt or your bra, and it has the wires that go in and spread out into the different muscles. And as you can see, they're connected individually to the different muscles and on the opposite end so that it's able to contract the muscle. Now to Christine Anderson, who's live on the scenes with Amanda Loricella.
Hi, I'm Christine Anderson and I'm here live with Amanda Loricella. Amanda, as you can see, is confined to a wheelchair. Amanda, do you mind explaining what happened to you and why you're confined to the wheelchair, if it's not too difficult for you?
I was at a bar one night and I was with some friends. And this guy came up to me and he started, kind of like flirting with me, kind of like, feeling out the waters, which usually doesn't happen. And I started, flirting back because I thought, maybe he's into me. And I didn't know that he had a girlfriend who was also at the bar. And next thing I know, she was coming up to me and she kind of got a little angry and she hit me, so I was defending myself, and next thing you know, I was pushed out of a window and I had a piece of glass in my back actually, and it hit my spine, and now I'm in a wheelchair. So
Touching story, Amanda. Now Kara, our assistant, is going to help Amanda use the kinetic maker for the first time, and we'll be back.
Hi! As we develop our new ATP pump, we're looking for ways to improve it. Since it is the size of a smartphone, we decided that to give you waterproof capabilities and hopefully get people with spinal cord injuries to be swimming and doing activities that could put them in the water, that we would need to waterproof our ATP pump. So as you can see, this is a life-proof case for a smartphone, but we're modeling our idea off the same thing. So we would have a cover here for the interface between the ATP pump and the person, and we would also have covers at all of these points on the side for your ATP tube and all of the other options that come with the ATP pump.
Welcome to the weather. Today, it is 70 degrees Fahrenheit, mostly sunny. There is also a 0% chance of rain. However, there is some fog in view. Make sure, for those of you who have your ATP pump, to go out and use this beautiful day to take a jog. Also, while you're on your jog, make sure to look at the nature outside and enjoy Mother Nature's beauty that she has given you. There's also a 45% humidity in the air, and tomorrow there's a chance of rain, so make sure to cancel your golf plans just in case.
Hi, this is going to be our new upcoming advancements for the ATP pump. Normally, in our previous ATP pump, you only had 3 screens of activities to choose from. Now, with our update, there will be its own activities app that you can choose, and once you click on it, it'll bring you to more activities. For example, when you come over here and finally click on the activities tab, it'll bring you to a new screen, kind of like your iPhone, where you click on an app and it'll bring you to a new screen. So in this new activities tab, we can have dancing, tennis, baseball, volleyball, soccer, football, and there are so many more to come. These are just a few examples that we have. We're looking for more sports involvement that won't restrain you to your wheelchair or any other assisted device that you may be currently using. We want to get you up and active and enjoying life as much as possible. We're taking these from different suggestions we've had from current users that use the ATP pump, so hopefully we'll have more coming to you soon. This is Amanda's first time using the kinetic maker that was previously surgically implanted into her, so the electrodes can connect to her muscles and to the actual kinetic maker. Surface properties of the kinetic maker: you're going to have a soft cannula, which is a thin, flexible needle made of a synthetic substance that is called Teflon, which is inserted into the subcutaneous tissue via a steel intrusor needle. The needle is then removed and only the soft cannula is left in place. The soft cannula sets are popular because they are comfortable to wear and they can remain inserted for up to 72 hours. The sterilization of this needle is radiation sterilization with electron beams because it causes less embrittlement than gamma rays. Ionizing radiation sterilization has excellent penetration and does not leave toxic residues on the cannula or the electrodes. Okay, we have a live caller on the line about the kinetic maker here. Hi caller, what is your name?
Hi, my name's Emily.
And are you interested in the kinetic maker or have any concerns?
Yeah, I was watching your news report and I just had a little concern because I am also paralyzed from the waist down due to spinal cord injury, and I was thinking of getting it, but I'm concerned about the toxicity and how it will react to my body.
Taylor, would you like to answer the caller's question?
Sure. So the silicone coated with the nitrocellulose makes it so that it's non-carcinogenic in the body and has low toxicity. So that shouldn't be an issue. And the needle is Teflon, which is also not suspected of causing cancer. So your toxicity risk should be fairly low.
Okay, so then I'm just concerned because I wanted to succeed in my body, and I want other people to be able to use this too, and I just don't want anyone getting hurt because I love people and I love animals. So I was just wondering, is it going to be in vitro or in vivo tested?
We're going to try and do both testing. We'll start in vitro in cell cultures and see how it takes to it. So far, Amanda is our first tester of this new device, and it seems to be working well in her. We also tried it in animals in compliance with the Animal Welfare Act and the IACUC regulations. So no animals got hurt. We tried them on dogs and it seemed to work fairly well.
Okay, good. I'm glad to hear that. So I'm also afraid of actually going into surgery, and I'm really scared of all the risks. So do you know of any surgical problems that can happen to me while I'm getting this installed in me?
The two biggest problems that we know of so far are the risk of skin infection at the interface between the cannula and the outside of the body. There's some risk for swelling and a risk of abscess or a cellulitis formation, just because you might get some bacteria in that area. And the only other thing that we've seen as a possible problem is unforeseen allergic reactions to any of the materials.
Okay, so then what about the risks after it's installed?
There really aren't many potential risks for this. The few that we have, the wires may misfire and not properly deliver the electrical signals, but as far as our testing has gone, that hasn't happened very often. The touchscreen may also stop working and may deliver different amounts of ATP, more than necessary, or may not be enough, which could become uncomfortable for the patient. Occlusion of the catheter would result in the inability of the ATP to pump, so that's if you had a blockage in the catheter, so the ATP wouldn't be able to make it to the correct muscle or not, and it could overwhelm the body, but it's highly unlikely.
Okay, well I think that's all the major concerns that I've had.
Okay, thank you so much for your call. We hope that the Kinetic Maker will help you out.
Thank you, I really appreciate it.
The Kinetic Maker has been associated with clinical trials. The first round of testing was in healthy volunteers. Second round of testing was in individuals with lower extremity muscle atrophy, not necessarily from a spinal cord injury. The third round of testing was in paraplegic participants with spinal cord injuries. A subgroup of third round of testing could include paraplegic individuals in the future so that research could extend the function of the ATP pump to the upper extremities. Post-trial surveillance of the ATP pump will ensure continued safety and efficacy of the product once in the market. All rounds of clinical trials should include more male participants than female, more Caucasian participants than other races, and the average age of participants should be approximately 41 years old to properly represent the spinal cord injury population in the United States. The process of FDA approval is very costly, which could forcibly increase the final product to consumer cost of the ATP pump, causing problems in post-market. The FDA approval takes many years. Pending desirable outcomes in early clinical trials, we desire to apply for accelerated distribution of the ATP pump, as is used in innovative and groundbreaking cancer treatments in hopes of reaching the consumer sooner. From CNN, this is Taylor Franzen.